A typical doctor's visit usually begins with the nurse checking your temperature and your blood pressure, right? Sure, the doctor may examine your ears, your eyes, ask a few questions, but let's focus on blood pressure. Why is your blood pressure such a high priority? It's a good question to ask. And here to answer a few questions about blood pressure is my friend and colleague, Dr. Michael Berglund.
There's a lot of reasons why people have hypertension or high blood pressure. First of all, let me explain to you what high blood pressure is. It's actually an elevation of the pressure inside the arteries. Now, the arteries are supposed to have a certain level of muscles and elasticity that happens. So when that heart pumps the blood through the circulatory system, some of that elastic picks up some of the pressure. If the body wants to send it a long ways, it squeezes the muscles down like you would put your thumb over the end of a hose, and it sends the blood further than it would normally go and faster. That's one of the laws of thermodynamics, just in case you're wondering. But anyways, so with high blood pressure, we're allowed to have high blood pressure at times because we need to. That's part of our makeup. So we're not really worried about, oh, I had high blood pressure when I came out of traffic on the interstate and I almost got hit by a car. That would be normal because you secreted adrenaline and that elevated your blood pressure. What we're concerned about is resting elevated blood pressure or resting hypertension. We do not want that because that puts an extra strain on our pump, which is our heart, and it has to pump through that extra pressure. The question is going to be, why, if you have elevated blood pressure, why do you have elevated blood pressure? And there are a lot of different reasons. One of the reasons, the common reason I see is those muscles, when they contract, they don't necessarily relax. Some people have a problem relaxing their muscles, and that's usually a deficiency of calcium or magnesium or potassium, or two of them or all three of them. So what I want to tell you is that when those muscles constrict and they don't let go, you're going to have elevated blood pressure even when you're at rest. The other one that happens a lot of times for people is inflammation. Inflammation acts as an irritant to the walls of the artery, causing it to reactively spasm and reactively constrict. As long as there's inflammation there, that constriction will stay there. Not only that, it also causes irritation of the walls of the arteries, causing problems with cholesterol and also calcification. So you can get plaques or blockages in the arteries. You can also get what's called hardening of the arteries. Remember we talked about that elasticity? Well, arteriolosclerosis, which is also called hardening of the arteries, means that there's calcium that forms in that artery that keeps it from wanting to stretch. Well, if you think, the best way you can think about that sense of blood flowing through and wanting to be picked up is this idea of the Bugs Bunny, and when you saw they'd turn on the faucet and you'd see all this water flowing through the hose. It's the same thing we feel when we do our pulse. We see just this blood comes through and pushes our fingers just a little bit away. That's that blood going through. That's the top number, and the in-between is the low number. The other thing doctors a lot of times use for this is diuretics. And diuretics are simply just a way of releasing some of that extra water in your bloodstream. The problem is with the diuretic is what's going to happen is your body's going to make more water and put it back in there. So the water is not, it's like the hose, and we're putting holes in the hose to try and get the water to leak out because we're worried about the hose being fragile. It doesn't make a lot of long-term sense. And in fact, we lose a lot of water and electrolytes like potassium and sodium and magnesium when we put people on long-term diuretics. The last one that usually happens with people is adrenergic or adrenaline. And people that do coffee, sometimes can experience elevated blood pressure. I had a patient recently that we took her off of caffeine. She loved coffee, and she had a creeping blood pressure. Every year it would kind of go up and up and up. We took her off the coffee. We put her on some magnesium, and her blood pressure is 118/70 consistently. And she doesn't really believe me sometimes, so she goes back and tries some coffee, and next thing you know, there goes the blood pressure again. So it's a obvious thing when it happens to you, and it's a very easy thing to solve. But naturally, we have a lot of, depending on what kind of problem you have, you've seen there's different reasons why you have it, and you could have 2 or 3 of these different reasons. But naturally, there are solutions. I personally, in my practice, have helped a lot of people get off their blood pressure medications and bring their blood pressures down into normal, healthy ranges. If you're watching this and you're tired of taking the blood pressure medications, or they make you feel tired, or they just bother you, you can seek an alternative provider and you can get help.
Maybe your blood pressure is a little high. Maybe it's seriously high. Your traditional care physician can write a prescription with a warning. You are in danger. You must go on medication. Well, it's true, the warning part, but not the medication part. Medication is not your only option. Make an appointment with your wellness professional. Find out what natural therapies and programs are available. With the right help, you'll not only fix your blood pressure, but you can experience a new level of health.